Hi, my name is Sarah Smithson. I'm a primary care provider at Carolina Advanced Health. And today I want to share with you the signs of a stroke and how to manage those signs, what to do. I have a lot of information to share, but I think the most important thing is for you to know how to recognize a stroke and what to do if you think a stroke is happening. So on the screen, I'm going to share with you those main points as I talk about the bigger picture of what is a stroke and how do you recognize it. So what is a stroke? A stroke happens when blood flow is limited to part of the brain. This can happen either because a blood clot forms and blocks flow, or because a blood vessel breaks and causes bleeding. When blood supply is stopped to brain cells, they die. And when they die, you lose function in the brain. And the parts of the body that are normally controlled by those cells no longer work. The impact of a stroke depends on the location and the extent of the injury. Small strokes may make it difficult to use an arm or leg. Larger strokes may actually paralyze an entire side of a person's body or limit their ability to speak. If stroke symptoms develop, a quick medical response is essential to maximize a person's recovery and limit lasting damage from the stroke itself. Strokes are common and they are absolutely an emergency. According to the National Stroke Association, approximately 795,000 strokes will occur this year. That's about 1 every 40 seconds. Approximately every 4 minutes, a stroke can take someone's life. 2 million brain cells die every minute during a stroke, increasing the risk of permanent brain damage, disability, or death. That being said, acting fast, I want you to remember FAST, like you see on the screen, F-A-S-T, can save a life and limit disabilities. So let's talk about how to recognize a stroke. What are the symptoms? Symptoms can include sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and at times a sudden severe headache with no known causes, although this may be less common than the other presentations that we just mentioned. So if you're worried that you or someone you know is having a stroke, what should you do? And this brings us to acting fast and calling 911 immediately. So let's go over those key points. Fast, so F stands for face. Ask the person to smile. Does one side of the face droop? A stands for arms. Ask the person to raise both arms. Does one arm drift downward? S is speech. Ask the person to repeat a simple phrase, such as no ifs, ands, or buts. Is their speech slurred or strange? And T is timing. If you observe any of these signs above, remember face, arms, or speech, then call 911 immediately. And it's important to note the time when the symptoms first appear. Treatment is more likely to be effective the sooner it's given. Certain clot-busting medications should ideally be given within 3 hours of symptom onset, so there's no time to waste. We talked about 2 million brain cells dying every minute during a stroke, and that the number of brain cells you lose relates to the disability that you can have immediately and in the future from your stroke. That states how essential it is to act fast, call 911, and get immediate medical care. So how can you prevent a stroke from happening in the first place? You can control blood pressure. Identify irregular heart rhythms if you think that you or a loved one may be having an abnormal or irregular rhythm. Absolutely stopping smoking. We know smoking damages blood vessels and increases your risk of heart attack and stroke. Control alcohol use, along with controlling cholesterol and blood sugars if you have diabetes. And of course, healthy exercise and diet will go a long way in keeping your cardiovascular system, including your heart and your brain, healthy. I want to review with you again how to act fast and call 911 immediately. The primary things to remember are face. Is there a facial droop? Arms. Does one arm drift downward? Speech. Does the speech sound slurred or strange? And T, timing. Call 911 immediately. Time is brain. To learn more, you can go to the National Stroke Association website at www.stroke.org. And as always, if you have further questions, please don't hesitate to contact your primary care provider for more information and for assistance that can be more specific to you. And don't forget, if you're worried that you or a loved one is having a stroke, act fast and call 911 immediately.